Hi there, good morning. Good afternoon, everybody. It's Monday. May the 4th be with you. We're starting our 8th week of response to the COVID-19 pandemic as it affects Mobile County. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, coming just here again today just to give you a brief update on our case counts and provide a little bit more information and maybe answer a couple of your questions that have come in either on Facebook or through the media. So this morning, when our public information officer released his daily dashboard worldwide, the Johns Hopkins data dashboard was reporting just over 3.5 million confirmed cases with almost 250,000 deaths. In the United States, 1.16 million confirmed cases with 67,000 COVID-19 deaths. And the Alabama Department of Public Health live dashboard was reporting 7,898 cases of COVID-19 with 292 patients who've died with COVID. And for Mobile County this morning, we were reporting 1,198 with 63 deaths. That's the information that's available on that public dashboard. And I'll get to a few more details about our finalized data analysis here in a sec. So the statement from our health officer this morning said, on Saturday morning when we got up and we're looking at the data, we had 69 cases reported just on Friday alone. That's the second highest case count that has been reported to us in a single day since we began. And Dr. Eichel said we reported a spike in confirmed cases Saturday morning. Majority were processed by a single lab and reported to the Alabama Department of Public Health as required by law. Fortunately, the numbers declined Sunday morning and Monday morning. Mobile has 1,198 cases and has tested 8,877 persons, compared to Jefferson County, who has 969 cases and has tested 16,000 persons. We get a lot of questions about why our case counts are higher than Jefferson County when we have fewer people living in Mobile County, and why they have so many more total tests reported. And we continue to look into that. There's not just one or two reasons, it's multifactorial, but we will continue to closely monitor as the laboratory confirmed cases are reported to us. So a little bit more about the Mobile County data. Again, around 16.5% of our patients are hospitalized, and around 7% have died with illness. Most of our cases are between the ages of 25 and 64, but more than 1/4 are still in that age group 65 and over, which has the highest risk of complications. We're still seeing predominantly female, 60% female, and the rest male or unknown. Around 43% cases are among African Americans, with around 28% white. And again, looking at some zip code data, we are seeing the densest cases sort of in the middle part of our county, where we have lots of folks living and have long-term care facilities in them that have outbreaks with clusters of cases at those locations. So a little bit more information than we usually provide, but we'll try to start having this daily in the report tomorrow. Among the cases that reported today in my report, it's 1,204. Among those cases, 163 or 13.5 were healthcare workers. 80 or 6.6% were known employees of a long-term care facility. Nearly 15%, 178 cases, were residents of a long-term care facility. And those that we know of, about 235 or 26.6% had recovered. And again, we know that much of this information is still incomplete or missing, but we just wanted to share with you the things that we know. It's harder to know what we don't know, if that makes sense. It does to me. Okay, so on our hospitalizations, there were 155 patients hospitalized with COVID disease this morning when we ran this report. We're still seeing most of them in the 65 and older age group. So 94 of those were in the 65 and over age group. Most of them are female. Most of them are African American, though we're starting to see that balance a little bit. Of our hospitalized patients, 70 or 45% required intensive care while hospitalized, and 39 of them, or 25%, required mechanical ventilation during their hospital stay. On the 63 patients we have who died from COVID, again, they're from the ages of 35 and 98. Over the weekend, we saw a death in a 35-year-old with underlying medical conditions and disabilities. This was surprising to us, so when I tried to look at it a little bit further, all of our other deaths have been in people over 50 years old. So this tragedy took the life of someone who was just 35, but again, that person had underlying medical conditions that made them more susceptible to severe complications and death from COVID. And I've continued to mention that among our deaths, all of them had underlying conditions or other risk factors. It may have been age that predisposed them to severe complications of COVID disease, and all of them were either in the hospital or under the care of a long-term care facility at the time of death. Of our 63, this is a new thing that I've not been sharing, at least 23 or 36.5% were residents of a long-term care facility, and 2 or 3.2% were employed by a long-term care facility. So that's a nursing home, an assisted living facility, or a skilled nursing facility. So a little bit more information than we've been sharing on our patient characteristics, and I'll try to make sure that gets into the report tomorrow. So a couple of questions from the media. Here's the first one, is about the spike in cases that we reported on Saturday. The spike actually occurred on May 1st, on Friday. There were 69 cases reported. 34 of those were from one laboratory, 14 of those were from our state laboratory, and the rest of them, onesies and twosies, from around 7 or 8 other laboratories. We're not sure if there was maybe an electronic backlog and the electronic processing of the lab reports, and perhaps that backlog got unstuck and they dumped into our system. It could be that because we have outbreaks at long-term care facilities, we are recommending greater testing at these facilities so that they can know who among their patient and employee populations are testing positive by PCR. That could explain some of the large increase, but again, we're still trying to get some visibility on this as we start our new week today. And then here's another question: any new cases about nursing homes or detention facilities? Yes, we are continuing to see positive laboratory results come back on patients and employees of long-term care facilities and at the detention center among inmates and correctional officers and other correctional staff. So stay tuned on that. So the question is, do we still have 6 nursing homes and 1 detention facility having an outbreak? No more. We actually, it depends on how you look at it, but for long-term care facilities, we have 7 facilities that have at least 1 or more cases in an employee or a resident. Most of those facilities have more than just 1 case, but because COVID is so infectious and because it can cause severe complications and death in these populations, congregate settings, people who are older, if they have a single case, we put them into our category as an outbreak investigation so that we can get on that as quickly as we can to help them contain it and slow the spread within their facility. We also are investigating or are consulting with facilities that are not traditionally long-term care facilities but have patients living in congregate settings. So this might be like a recovery or a rehab unit or a group home or something of that nature. We have several of those that we are engaged with. And then we also have a couple of senior citizen apartment complexes that we're keeping a very close eye on. And we have begun, last week we began and have continued to do this, to reach out to all of the senior citizen or the 55 and older housing complexes, apartment complexes, so that we can talk with them about how they need to restrict access, limit visitation, encourage face coverings, those sorts of things. So we have a lot of facilities that we're talking to right now. Let's see, how are the patients assigned to zip code determined? This is based on their residence. So it's the zip code of their home, their permanent home of residence. Here is a question about Crown, one of our long-term care facilities, and sorry, but you'll have to reach out to them directly to see if they're willing to share with you their current case count among residents and employees. And again, just to, as a reminder, particularly in the long-term care facilities where we have outbreaks, this is a fast-moving train, and we are often a few days behind with the investigation, getting the names and all of the complete information on people who test newly positive, and getting that information into the surveillance system where then it can be used for reporting like I do daily. So it's not a surprise if things don't seem to match up online, right? I have been doing this for a really long time, and I call it disaster math, because during a disaster, the counts, the number of illnesses or deaths or fatalities, it's never going to add up perfectly across different sources. And so if you see something like a zip code map that has a certain number of cases by zip code, and you think there are more cases than that just in the one long-term care facility, it's a fast-moving train, and we are doing our best to stay up with the data, but it doesn't always come in as quickly as we would like. All right, over to some Facebook. How many tests have been analyzed with positive or negative? The test result number that is on the live dashboard is the only number I know. I don't have insider information on any better information. So this morning, the test, both positive and negative, for Mobile County residents was 8,882. So we know among these, about 1,200 were positive. So I presume that the balance were negative. But again, it's probably not all of the negative tests, because we know that some labs are not able to submit negative test results as quickly or as seamlessly as we would like. Let's see, can we have an easy access to a link to see the actual number of cases daily? Yes, go to alabamapublichealth.gov and click on the coronavirus page, and there is an image of the real-time data map. It's updated throughout the day, every day, and that is where you can go to see things throughout the day if you don't care to read the report that we put out. Again, alabamapublichealth.gov. So we had some chatter on Facebook about Centers for Disease Control, that agency. I worked for that agency for 20 years. Lots of rumor and things out there that CDC is not a government agency, that they're privately owned, and none of this is true. CDC is a government entity. There is such a thing called a CDC Foundation, which is a nonprofit organization that does receive funding from places like large philanthropic organizations like Robert Woods Johnson or Bill and Melinda Gates Foundation, those things. So yes, CDC, Centers for Disease Control and Prevention, is a federal government agency, and their foundation partner receives funding through many different funding sources, federally funded, private funding, donations, that sort of thing. So a question about addressing the big box stores that aren't being forced to abide by occupancy limits that have been put forth by the governor and the state health officer. This is a law enforcement responsibility. When we hear of violations of the state health order, and again, if you are found to be in violation, you can be charged with a misdemeanor offense. And when we find or we hear about egregious violations of that order, we work with our law enforcement officers, our law enforcement partners in the Unified Command to look into those. But honestly, it happens so often, and we have a lot of snitches around the county that like to let us know when this is happening, and we appreciate your concern for your community, but we're not able to follow up on all of them. But we do from time to time, go out and double check or have conversations with business owners to try to encourage their compliance with those orders. Let's see. Somebody was asking a question about the number of hospitalizations and ICUs. I just answered that. Here's another question about antibodies. How can someone get tested for antibodies? We have been prioritizing PCR testing for active infection, and you can check our website to see where there are 10 known PCR testing locations around the county, and we're hearing that there's plenty of capacity for testing. The new location, the new Saraland location that was just opened last week, is shut down early on Saturday and Sunday because they just did not have the demand for testing that they were expecting. So you can get tests, and again, we continue to prioritize the PCR test. The antibody test is a little tricky because there are only 2 or 3 that are approved by the FDA under emergency use authorization to be used by clinicians at a high complexity laboratory. The tests that are being used outside high complexity laboratories are really the certainty or the appropriateness or how valid they are is largely unknown. CDC is still trying to wrap their hands around this because there's a lot still unknown about these antibody tests that are flooding the market. So I don't know where those are being provided, and I caution you that you remain well informed about what a positive and what a negative antibody test means, so that you don't test positive and think you're immune when you're not, or test negative and think you don't have COVID and you could catch it the next day and need a PCR test. So please proceed with caution when you're considering an antibody test. Do I think coronavirus will stay around for 2 years like the Spanish flu did in 1918 and 1920? Yes, I do. We are likely to see waves similarly to what was observed in the Spanish flu, which is why we are looking at our information even more now, because since the restrictions were lifted last Thursday at 5 o'clock, you guys probably were all out this weekend, just like I was, trying to enjoy the good weather, and saw people all over the place in public not wearing face coverings, not obeying or complying with the 6-foot physical distancing. Yes, if only 3 people can go inside Pizza Hut to pick up your pizza, that doesn't mean that 30 people can gather in the parking lot within 6 feet of each other, and they're in violation of the order when that happens. But we know that happens. It's not just Pizza Hut, it's everywhere. There was only one store that I went into this weekend where actually it was my sister-in-law who was told you are required to wear a face covering when you come into this shopping, if you want to shop here. And so they promptly sold her one so that she could get her shopping done. So businesses, please continue to stay open to provide carry-out or pick-up dining. It's important, so important that we have that. We're glad that the retailers are able to reopen, but please, retailers, dining establishments, please try to enforce the physical distancing and the face covering recommendations to the greatest extent possible. So here's someone else asking about waves or of the virus, and asking what the probability is that the virus has mutated with a new wave. So far we have not seen a lot of genetic sort of reorganization or mutation happening with this virus. So I don't think that mutations will be the reason that we have additional waves or several other peaks. It's because our entire world, the population of our entire world, has absolutely zero immunity. And until we have herd immunity, either through exposure to the live virus or through a vaccine, we're going to continue to see these waves of peaks and valleys in our transmission pattern. Was there a 14-day decline of cases in order to approve openings? No, we have not seen a 14-day decline in testing. If you'll read the president's report, they're talking about there being sort of 3 big gates that are being measured when considering reopening. Has to do with the number of cases, what hospitals are doing, number of lab results, that sort of thing. So we are nowhere close to seeing a day over day decline in cases. I mean, we just saw the most reported, our second highest reported in one day just on Friday, 3 days ago. Right. Let's see. Okay, I just want to revisit a couple of thoughts that we talked about a long time ago, but not everyone watches every day. So I just want to revisit a couple of things. You know, in the beginning, we did not know that COVID-19 could be spread through asymptomatic or pre-symptomatic viral shedding. So what this means is that people who are infected and have no symptoms or have not yet begun symptoms can spread the virus. And this is one of the reasons that we changed course and started recommending cloth face coverings, because this way, if you are infected and don't know it, this will keep your cloth face covering will keep you from spreading your germs to other people. And that's what we're trying to accomplish there. That was something very different than we were saying in 2 months ago when we first started chatting with you about COVID. The incubation period is still 2 to 14 days. So this is the time between you are infected and when you develop symptoms. So you can develop symptoms as quickly as 2 days or out to as many as 14 days. The range is usually 2 to 5, but it depends on your immune system and other conditions and your age and all of that. So the incubation period, or the time it takes for you to begin showing symptoms after infection, is 2 to 14 days. The isolation and quarantine of people who are symptomatic or who test positive is changing again. It just changed yesterday from the Centers for Disease Control. And this is really confusing, not just for you, but it's super confusing for all of us that are trying to talk to people who have COVID positive labs or who are sick with COVID. And now what CDC is going to is what they're calling the 10+3 strategy. So symptom-based strategy for lifting isolation, right? If you have a symptom, we've been saying stay home until you're symptom-free for at least 7 days and go at least 3 days without a fever. But this is changing now, and it's stretching to 10 days. So you need to stay at home for at least 10 days past your first symptom, and you need to be symptom-free, fever-free, symptom-free for at least 3 days. And this has to do with what we're seeing out there in a lot of locations, and people are hearing about this, that people who test positive, when they're trying to test them negative to go back to work or leave the hospital or something, they are positive for 2 weeks, 3 weeks, 41 days, 44 days, and people are continuing to shed. And the PCR test, yes, detects live virus, but it is possible and probable that people who are still shedding for more than 10 days past their first symptom are just shedding virus particles. Through some of the science and data that CDC has reviewed, none of those patients have been able to have the virus cultured from their respiratory tract. So that is the reason that CDC is going back to, or extending that period to be 10 days with 3 days symptom free. And there's also no longer a preference for whether you do a 2-day PCR, a 2 PCR test lift of isolation or a symptom-based lift of isolation. So those of you that are working in the healthcare industry and hospitals and long-term care facilities will be providing some guidance about that. I already talked about PCR versus antibody. Wear your face coverings, please. Wash it once daily, so you really need to have at least 2. I talked about the Saraland location not being burdened and even having to close early, so there is testing available out there. And then again, just remember that we have 2,000 cases in Mobile now. Someone dies in Mobile with COVID-19 almost every day. It's a very infectious virus. Outbreaks are happening in congregate settings throughout our county. So please continue to take this credible threat very seriously and do your part to help keep our community safe by complying with the Safer at Home order, respecting that 6-foot physical distance, wearing your face coverings, and continuing to wash your hands, keep your hands out of your face, and stay at home if you're sick. So be safe out there, and we'll talk to you again tomorrow.